Now we're going to cover the topic of shock. In my opinion as a paramedic, shock is one of the most lethal syndromes that a person can go into, in that it is multi-symptom, it is complex, and in the end, everybody dies from the same thing. Shock, from one form or another. Now why is that? Well, it's because shock is basically the failure of the body to circulate oxygenated blood to the level of which it needs to keep cells alive, for whatever reason. And that reason could be that it's anaphylactic in nature. It could be that they have hypovolemia, which is low blood pressure due to low volume of blood. It could also be a form of that because they didn't lose any blood, but the heart isn't beating strong enough. We call that cardiogenic shock. And then another one that we see in multi-trauma or severe trauma systems is when they go into spinal shock or a neurogenic shock, which is when we have a spinal cord injury or a severance and there's no communication from the brain to the rest of the body to fight or flight, which is what keeps people basically stable. It keeps their blood pressure up, it makes their heart beat faster, it makes their vessels constrict, and so on and so forth. So what do we do to save these individuals' lives, or to at least buy them time until we can get them to definitive care and fix the reason that they're actually in shock in the first place? There's several things we can do, and they're very helpful. First thing is to recognize it. What are the signs and symptoms of shock? They kind of have a progression. They'll start at very minimum. Nervousness, they might be a little bit of a rapid heartbeat, they're a little sweaty, anxious, they're fearful that they might be in trouble. If I notice that, I'm going to keep an eye on them. They then begin to become more pale, more rapid breathing, rapid pulse, maybe clammy, and they're very cold. That coldness comes primarily because the body is shunting blood away from its extremities to keep it in the vital organ area. But because of that, the blood is not flowing out to the extremities and the individual may feel cold. They may also begin to show signs of blue-colored nail beds. If we pinch the nail bed and it takes more than 3 to 4 seconds to refill, or the time in which it takes to say capillary refill, we call this a delayed capillary response. And this response is what shows us that they may actually be showing the next stage and sign of shock. Now, when we get into that situation, our treatment plan has got to be pretty confident and it has to be pretty quick. We're going to maintain their airway, make sure it's open, help them breathe if they're not breathing normally, and we're going to help them with their circulation by stopping major bleeding that's external that we can control. We're going to lay them down as long as they're not having trouble breathing, and we're going to elevate the legs above their heart in the cases where they do not have long bone fractures, hip or pelvis fractures, or back and neck injuries. If they don't have those injuries, and I would even leave the exception of an arm fracture. If they have an arm fracture and it doesn't relate to their lower limbs or their body from where it interacts with the spinal cord, I'm still going to elevate the legs. So we elevate the legs. And then if you don't have a stretcher that elevates, you could always use a box or a pillow or something to put their feet on. And then we're going to cover the patient with a sheet, coat, or blanket. If all you have is newspaper or something to help the person stay warm, it's still going to help insulate them better than if you didn't do anything at all. Remember, there's cool and clammy. They're starting to expire because of the adrenal dump and all the fight or flight mechanism. But this warming of the patient helps them with their own internal abilities to fight the shock symptoms. It's at this time that we need to make sure that if we've not already activated EMS or 911, we've done so now to get them to definitive care and get them back on track.